Hey everyone. So today I'm going to talk about a wonder drug that reduces heart attacks and reduces heart failure symptoms as well by increasing your total and LDL cholesterol. So, obviously, this is not a statin. And before I reveal the name of this drug, I just want to show you a summary of more than 44 trials that have examined cholesterol lowering drugs and how much of a benefit they have in cardiovascular disease. So there's 44 trials examined, and none of them have any significant mortality benefit. You would think that if heart attack is caused by high cholesterol, that lowering your cholesterol would at least reduce death in one trial, right? And I've explained some of these trials before and explained about how they use relative risk to exaggerate the benefits. So I'm simply not impressed by the results of these cholesterol lowering drugs. Now let's look at a really interesting phenomena of insulin resistance. So this paper examines that in a patient with insulin resistance, their heart literally functions in a different way. Their heart is not healthy, and a lot of their organs are not. So I'm going to explain that in a simple way. If you have a healthy insulin sensitive body, then what insulin does is it allows the cells of the body to use glucose as energy. And insulin has a lot of good effects on the body generally, as long as you don't have too much of it. But if you have insulin resistance, that means that your cells are not responding to insulin. Then you are essentially starving your cells of glucose because they're not really responding to insulin anymore. And the downstream effects of that are quite dangerous. So you don't get enough energy to the heart. You have increased inflammation, so then your heart can become bigger and your heart cells can start getting destroyed. You can have something called endothelial dysfunction, and that means that your blood vessels are getting damaged. And I want you to know that this is one of the main steps in plaque formation, endothelial dysfunction. So, keeping that in mind, this cartoon is beautiful and shows you how insulin resistance works. So, insulin promotes the uptake of glucose into the cell as energy using insulin receptors on the surface of the cell. And when you have insulin resistance, the insulin receptors have basically stopped responding to insulin, and then it's unable to take up that glucose because without insulin, you cannot take up that glucose as energy. So then what happens to that glucose? That glucose goes and gets attached to proteins. So sugar is very sticky, right? We put some sugar on our hand, it gets sticky. And that's exactly what sugar does to every part of the body, not just the hemoglobin. So this cartoon shows you that the red blood cell has now become quite sad because sugar is attached to it. And that's why doctors check something called HbA1c to see how much sugar is going and getting attached to your red blood cells. So, as I mentioned, sugar goes and damages everything. It's been implicated in aging, it's been implicated in pretty much every disease, eye problems, arthritis, liver disease, kidney problems, atherosclerosis, which includes heart attacks, strokes, etc., and even psychiatric mental health issues such as depression, dementia, schizophrenia, etc. You also have high risk of recurrent infections. So there's not a single part of the body that is spared. So now let's talk about what is this magical drug that reduces heart attacks and heart failure. It's something called SGLT2 inhibitor. So it is an anti-diabetic drug which reduces your blood sugar by peeing out the sugar. It allows you to just pee out all the sugar, And this drug has seems to have had a lot of good benefits in mortality and especially in heart failure patients. It is so good that the American Heart Association has said it's serendipitous that we found such a wonder drug. And it has additional benefits. I mean, it lowers blood pressure, it produces weight loss, improves diabetes, and amazing benefits for those who have heart disease as well. And the only caveat is you're peeing out a lot of sugar, so then you have a high risk of getting infections in your urinary tract. Um, so this is quite a breakthrough as per Nature Cardiology. So I examined this paper from the British Medical Journal, which explains how these amazing drugs work. So I'm going to verbatim quote some lines from the paper here, and I've underlined it as well. Diabetic drugs, that is, glucose lowering agents, are either ineffective or harmful, and they increase your risk of death, hospitalization, and heart failure. Okay? Just let that sink in. So, diabetic drugs are a failure and they increase your risk of death. But except this drug. This drug is amazing. And how does it do it? It produces ketone bodies, it promotes ketone body production. Because you're peeing out so much sugar, you're forced to go into ketogenesis and you're forced to use ketones as energy. And this seems to have some amazing benefits. It repairs the mitochondria, it promotes autophagy, and that's why it seems to do so well. Another paper examining the benefits of this drug. It has a shift towards ketone bodies as a metabolic substrate for the heart and kidneys, thereby reducing inflammation and sugar damage. I'm verbatim quoting this paper, and they've attached some nice diagrams explaining how it helps you lose weight and it improves your kidney function, heart function, etc., etc. So, ketone bodies for the failing heart could be fuel that fixes the engine. And this state of the art review also has explored the therapeutic potential of ketone bodies for the failing heart. And this paper has called ketones a guardian angel because in an insulin resistant heart, you're not getting glucose as energy, but these ketones are bypassing that insulin and providing energy to your heart. And let's look at this paper. Very interesting. So this paper has is a review looking at a lot of studies, and it has said that these drugs actually have anti-atherosclerotic properties. That means anti-plaque properties in the body. It reduces inflammation, it reduces stress, oxidative stress, it reduces dyslipidemia, which is abnormal cholesterol. It improves endothelial function. So, overall, excellent outcomes. It's doing some really good things. Isn't that amazing? So, the next question is it doing so by reducing your cholesterol? An analysis of 60 randomized trials has shown that this drug, which is having so many benefits, increases your total cholesterol and your LDL cholesterol. So I think this is a nail in the coffin for the cholesterol hypothesis, and I hopefully don't have to make a video about this again. So it seems that this drug transforms small dense LDL, which is the bad LDL, into healthy LDL cholesterol, the fluffy one. And I've talked about this before in my videos as well. And what else? There's something else that also does the same thing, that increases your LDL cholesterol but reduces the dangerous small dense LDL, and it's butter and meat. So I'm quoting this line from the paper I presented earlier on about the cholesterol paradox. Despite cholesterol lowering treatments on a population basis, chronic heart disease, coronary heart disease, is now a pandemic. Some may argue that this pandemic is secondary to the explosion of obesity and diabetes. I completely agree with that. And number two, it could also be that the cholesterol hypothesis is wrong. I completely agree with that as well. And I think I have provided enough evidence to prove this hypothesis wrong. Now, I'm going to go into a little bit about why we have had this pandemic of obesity and diabetes. Um, it's because we have promoted a high carbohydrate, low fat diet and eating multiple times a day. And we've started promoting processed vegetable oils, which did not exist before the 1970s. And then we also demonized red meat and promoted things like chicken, which, if it's not a organic free range pastured chicken, it's going to be very, very high in omega 6. They're grain fed, they're full of antibiotics, hormones, etc. And I'm going to go a little bit more into this, but before I do that, I'm going to go over a few factors that cause heart disease, heart attacks. No cardiologist can deny smoking is a big risk factor. Stress, sedentary lifestyle, not enough activity, excess alcohol. There's a question about red wine being maybe protective. But things like diabetes, high blood pressure, abnormal cholesterol, and obesity are without a doubt very significant risk factors for heart disease, including smoking as well. And these four I've highlighted in red because all of them can be reversed with diet. So, this is again a chart of what happened when we told people to start eating low fat crap and eating vegetable oils. So now I'm going to explore a little bit more about vegetable oils. So, firstly, they are extremely processed. It's the most processed food present in our diet, and they are very, very rich in omega 6. So, our body needs a good ratio of omega 3 to omega 6 in order to function properly. And there's a lot of evidence showing that if your omega 3 levels are low, then that increases your risk of heart attacks, diabetes, stroke, blah, blah, everything else. And there is so much significant evidence on a population basis that scientists have even released a whole book about it. So I highly recommend this book called The Lipid Nutrition Guidelines, which talks in detail about omega 3 to 6 ratio and how that's implicated in a lot of chronic illnesses beyond heart attacks and cancer and things like that. So now we're going to go into smoking. Okay. Smoking is a risk factor for heart attacks, no doubt about it. And this figure shows you evidence of that. So, saturated fat consumption has remained the same for about 100 years, and heart disease has gone up and then down. And this directly correlates with smoking. Okay. So, keeping smoking in mind, I want to discuss why smoking is bad for the heart. And this is going to be the last nail in the coffin for vegetable oils. And I hope that anyone watching this video will never touch vegetable oils again. Um, there is a link between smoking and vegetable oils. So, first question is, why do cigarettes cause heart attacks? And it's not just cigarettes, even pollution can cause heart attacks, and this is established in the literature. Because they have a lot of carcinogenic chemicals which can damage the proteins in the body, causing oxidative stress. Okay, it's not because they increase LDL cholesterol. Um, so scientists have analyzed how much aldehyde is present in vegetable oils. Okay, and they have found that a large serving of French fries is similar to inhaling the smoke of 20 to 25 cigarettes. Just let that sink in. So, vegetable oils, eating something fried in vegetable oils, is as bad as smoking 20 to 25 cigarettes a day. So, when you're eating potato chips fried in vegetable oil, and all everything basically, most of the foods have vegetable oil in it, think about that. So, I've explained that vegetable oils are horrible for you, so please avoid it. um, so, in summary, cholesterol lowering drugs are a big failure. The cholesterol hypothesis itself is a big failure when you look at the evidence and apply logical thinking. Diabetic drugs are a big failure. I mean, they literally increase your risk of death, hospitalization, except this one wonder drug that I talked about. The one diabetic drug that actually has good outcomes is the one that increases your cholesterol, and vegetable oils are much worse than cigarettes or sugar. Now, I just want to conclude with this anecdotal evidence of this man that I met at a conference who was very passionately fighting, and talking about metabolic health and everything like that. So he had so many health issues: high blood pressure, he had erectile dysfunction, enlarged prostate, gout, angina, which is basically heart attack. He had diabetes, he had muscle pain, etc. He had this for 17 years and he was on more than 9 medications. Once he switched to a low carbohydrate diet, he reversed all of his issues. Okay, he reversed his obesity, he reversed his high blood pressure, he reversed his diabetes. So that's automatically reversing a lot of risk factors. And he reversed his angina. He reversed his angina. Okay. And sure, this is anecdotal evidence. But to me, this is a man who was suffering for 17 years, who was failed by conventional medicine. So, 17 years of all of these conditions, 17 years of evidence that the drugs did not work and they did not help at all. So, that's what I would like to conclude with. Thank you.